I am Dr. Sujit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Myself, Dr. Sujit Ghosh from channel Dr. Ghosh Presents. You know, I am doing for last more than 1 year videos on homeopathy. There are 4 different playlists. Homeopathic therapeutics in Bangla, homeopathic therapeutics in English, homeopathic remedy picture in Bangla, homeopathic remedy picture in English. Now actually what I want to say is that you will get about 12 to 1300 videos on this subject. Top 8 homeopathic remedies for hydrophobia. What is hydrophobia? Though etymologically, hydrophobia means fear of or from water, in medicine it transpires a full-fledged, dreadful or fatal disease caused by rabies virus, characterized by painful involuntary throat spasms, mental confusion, aggression, excessive salivation, owing to inflammation of central nervous system. What are the signs and symptoms of hydrophobia? Involuntary spasms of the throat muscles. This is the most important thing, which most conspicuous and distinctive of this particular disease. Involuntary spasm of throat muscles. For that reason, water cannot be swallowed, neither saliva can be swallowed. This is the reason for not capability of drinking water and etc. Intense fear, anxiety, panic when thinking of water. Hyperactivity, aggression, mental confusion, fever, headache, excessive salivation, delirium, hallucination, insomnia, paralysis, and finally death. What is the cause of the disease? What is the cause of the disease? Bites, scratches, even licking of animal infected with rabies virus. The true name of the virus is Lyssa virus type 1. See, this is the face of rabies dogs. Mind it that hydrophobia can be caused by any animal. Any animal means dog, cat, hare, even moles, anything. You have to know whether it is carrying virus, rabies or not. If it is carried rabies, then it can create hydrophobia in man. It is a long conception that only dog can cause hydrophobia. How is the disease developed? Now look at this particular pamphlet. This pamphlet I have collected it from internet and directly pasted it here. The steps are given here one by one. Number 1 step: virus enters tissue from saliva of biting animals. This is the starting position. Virus enters the tissue. Virus replicates in the muscle near bite. Here immediately the virus starts replicating. This is the nature of the virus. It goes on replicating with fast speed. Bite. Then virus moves up in the peripheral nervous system. Mind it goes to nervous system, not blood. Not blood, but nervous system. And nervous system means the transmission is very fast. Like electricity. Virus moves up peripheral nervous system to central nervous system, C.N.S. Virus ascends in spinal cord. From spinal cord, virus reaches brain and causes fatal encephalitis. This is actually the cause of death. Encephalitis, that is brain matter, inflammation of the brain, whole brain, and that will cause death. Virus enters salivary glands and other organs of the victim. That is, then the person who has been bitten has become another source of virus. In that position, if he or she bites somebody, then that person will be affected with hydrophobia. That is, man can cause hydrophobia in that case, in that situation actually. Which animals can cause hydrophobia? Any animal, mind this, any animal including man, any animal, domestic, wild, carrying rabies virus can cause hydrophobia. Actually, it is a wrong conception that only dog can cause hydrophobia. Hydrophobia can be caused by any animal, even by a rat, by cat, by mole, by a calf, by a dog, cow, any animal. If it or she carries this particular virus, he can or she can cause that hydrophobia, the person. Is the disease fatal? As the disease progresses, the person may experience delirium, abnormal behavior, hallucinations, hydrophobia, that is fear of water, and insomnia. The acute period of the disease typically ends after 2 to 10 days, maybe less than 10 days, maybe 5 to 6 days also. Once the clinical signs of rabies appear, clinical signs means that signs I've already mentioned there, that is, these are the clinical signs. Once the clinical signs of rabies appear, just elaborated in the previous slide, this disease is nearly always fatal. That is, if clinical signs once appear, then it would be useless to give any medicine or any treatment. The disease is nearly fatal means death will come, and treatment is typically supportive. That treatment, if you give some treatment, that will be supportive. That support, that will not cause the living of the patient. The patient will die. This is the picture, microscopic or ultra microscopic picture of rabies virus. Is hydrophobia curable? If treatment is administered before clinical symptoms of hydrophobia are manifested, it is curable. However, once clinical symptom appears before treatment is given, it is 100% fatal. That is sure death. So, do not wait for symptoms to appear. Get medical help immediately after bite. If you doubt that it might be a case of hydrophobia, that is, if the animal carries rabies or not, if you are in doubt, you straightforward take the help of a doctor. When to consult a doctor in the case of hydrophobia? Whenever one doubts that the case might be a case of bite of an animal carrying rabies virus, one must consult a doctor without loss of any time. Without loss of any time. Is hydrophobia contagious? No, it is not a contagious disease. It does not spread by touch, nor via air or water, neither via any substance. It starts only when rabies virus comes in contact with blood of any animal, including man. Now we will discuss homeopathic remedies for particular cases. Cantharis for hydrophobia. Alternate paroxysm of rage and convulsions excited by touching of larynx, by sight of water, or by making pressure on abdomen. Face pale, yellow, wrinkled, with constant frown and expression of great suffering. Excessive desire for coition with painful erections. Scutellariae for hydrophobia. Depression of nervous and vital powers. Spasmodic closing of jaws. Tiredness of facial muscles. Hashimotosis for hydrophobia. Posterior part of throat affected. Thrust, dryness of throat. Mental derangement with occasional muttering. Horrid anguish, fits of anxiety. Move about from one place to another. Belladonna for hydrophobia. Throbbing headache with red face and visible carotid pulsations. Head drawn backward or burying head into pillow. Want to bite others. Highly sensitive to cold air. Tanacetum valve for hydrophobia. Great weakness of legs with overall prostration. Tendency to bite. Voracious depraved appetite. Depraved appetite means appetite for abnormal things. Convulsions followed by long-lasting coma. Convulsions with consciousness. Opisthotonus. Opisthotonus, I give a picture on the right hand side, please just note. Spasms of muscles of pharynx, larynx, and whole thorax. Vipera for hydrophobia. Raving delirium. And wandering as if drunk. Edema of face, salivation with deathly faintness, hunger and craving for cold drinks, faces expressing terror. Stamonium for hydrophobia, afraid to be alone, great desire to bite persons around. Frequent spitting, saliva drooling from mouth, any bright object causes furious delirium, spasms of throat and horrible convulsion. Lachesis for hydrophobia, deep stinging throughout the body, distortion of face, hurried talking with headache and constrictive sensation in throat. Convulsions with violent shakes, sopor with cessation of pain. Sopor means deep sleep. Deep sleep after cessation of pain, when the patient goes into sleep, this is called sopor, deep sleep. This is found in lachesis, very specific symptom. Is there any general preventive homeopathic remedy which can be taken just after a doubtful bite before manifestation of specific signs and symptoms? That is, in each and every case, you have got a bite, you do not know whether this is a purely rabies virus case or not, a doubtful case. Now, but you have to take some preventive action. Now, what medicine can be taken? In my personal opinion, I think there is one homeopathic remedy that can be taken blindly after receiving a doubtful bite. It is hydrophobinum. Hydrophobinum, you know, this medicine actually is prepared from the saliva of rabies animal. That's why its name is hydrophobinum. 3 to 4 globules, 2 hours, 4 doses. Next day, same remedy, 200, 3 to 4 globules, 4 hourly, 2 doses. I think this is sufficient to guard a doubtful case. Whether it is a real case or not, it will support all situations. It is from my general experience and opinion. You may ignore it, but I think, I will take this course. Thank you for listening and viewing. Got anything to say? Please write in the comment section. I would certainly attend.